Can you take magnesium with an ACE inhibitor for blood pressure? For most people, yes. And there's actually decent evidence that magnesium can help your blood pressure medication work a little harder. But there's one specific situation where this combination becomes a real problem, and most people taking these drugs have no idea about it. I'm Steve, a pharmacist, and on this channel, I break down supplement and drug interactions using the actual evidence, not internet panic and not blanket reassurance. So here's what's going on. ACE inhibitors lower blood pressure by blocking a hormone called angiotensin II. Magnesium relaxes the smooth muscle in your blood vessel walls through a completely different pathway. The mechanisms don't fight each other, they actually nudge in the same direction. In a 2017 meta-analysis, magnesium supplementation lowered systolic blood pressure by about 2 millimeters of mercury on its own. Modest, but real. So if you stack it on top of an ACE inhibitor, you can get a small additional drop. For most people, that's a feature, not a bug. That's why these drugs exist. The problem is when that extra drop tips you into actual symptoms. Dizziness when you stand up. Lightheadedness, feeling faint. That's the first thing to watch for, and it's especially relevant if your blood pressure is already well controlled and on the lower end. Now here's the part most articles skip. ACE inhibitors raise your potassium. They also can reduce your kidney function, especially if you're older, dehydrated, or already have some kidney impairment. And here's the key fact. Your kidneys are how you get rid of excess magnesium. So if your kidney function is reduced, magnesium can build up in your bloodstream. That's called hypermagnesemia, and it can cause muscle weakness, low blood pressure, slowed heart rate, and in serious cases, breathing problems. This is rare in healthy adults. But if you have chronic kidney disease, this is the actual risk worth knowing about. So here's what to do if you're taking both. First, if you have normal kidney function, magnesium is generally safe alongside your ACE inhibitor. Standard doses, around 200 to 400 milligrams a day, are well tolerated. Second, if you have any degree of kidney impairment, do not start a magnesium supplement without checking with your doctor first. This isn't being overly cautious. This is the one scenario where the combination genuinely matters. Third, when you start magnesium, monitor your blood pressure for the first 1 to 2 weeks. If you feel dizzy, lightheaded, or notice your readings dropping below your target, talk to your prescriber. Sometimes that means adjusting the magnesium dose. Sometimes it means your medication itself can be lowered. Fourth, pick a form your gut tolerates. Magnesium glycinate and magnesium citrate are both well absorbed. Magnesium oxide is cheaper but causes more loose stools. The bottom line, magnesium and ACE inhibitors are a generally safe combination and may even be modestly helpful for blood pressure control. The one real exception is reduced kidney function, where this needs to be a doctor-supervised decision. The full guide with references is on LiveHealthyRX.com. Link in the description. If this was helpful, consider subscribing. I cover these kinds of supplement drug questions every week,